We had two incredible presenters and a great clinical challenge today. I think this may have been my favorite, and I know I say that every time, but I mean it every time. We started with Louise talking about the mental health needs of children in PWS and co-designing programs with clinicians, researchers, and people with lived experience. We talked about the gaps analysis of service provision, which included a national survey with a goal to assess and characterize the needs of individuals with PWS and their families to inform service development. The focus on early life, physical health, mental health, education and employment, and the impact on family. With the early life challenges were prominent with stays in the NICU, the majority of infants being on feeding tubes, and the multidisciplinary needs of obesity, highly complex medical needs, the access to multi-medical specialists, and these vary depending on life stages as needs change over time. Needs have disproportionate reduction in adaptive functioning, not necessarily based on IQ, mental health needs, anxiety, depression, OCD, psychosis, an elevation in PWS in relation to the control group. The impact on family is severe, emotional, physical, financial, and the impact on family relationships, educational, and employment. Many adults didn't have meaningful employment or access to residential or respite care. The good news is that there was less morbidity. People are living, but there's an increase in obesity and other physical illness and an increase on the impact of the family. The recommendations were multidisciplinary supports, specialists in mental health teams, the need for PWS specific residential care. And Max talked about the outpatient mental health and rare diseases and the adults with mental health services, medications versus the environment, time and communication, outpatient with individuals who are 12 plus living at home and also individuals living in specialized care units. The time required for care to see people and their parents takes time, and it takes time to see change. Talked about meds versus the environment. You don't treat if you don't treat the patient's environment, you don't treat the patient, you treat the environment. You can support with meds, but you won't see a change unless the environment is addressed. People with PWS need continuous lifelong support. Multi-professional teams need to treat the system by providing help to parents and siblings, and these supports need to be lifelong with specialized attention during crisis and emergencies. Time must be allotted for those that require higher level of care. If you don't provide help to families, the family unit and the person with PWS won't be as successful. Educating the families can increase the success rate and decrease the negative impact on families, and help the families map out structure for future success. Talked about temper tantrums and the response threshold and focus. Thank you, Brian. I really liked that. The focus may change over time, but the tantrum response doesn't necessarily change. Integrated care is so important because while symptoms may be similar, we need to take a person-centered approach as each individual has their own needs. The discussion about specialized care and the need for PWS specific living and work environments to decrease stress and increase success and quality of life. And the clinical challenge, when services fail, and we heard two very unfortunately not unique situations. We've seen these things happen time and time again, maybe not with the severity how these two ended, but we know that the lack of understanding by the health system and social services has a direct impact on a person's success. There was a failure to appreciate the seriousness and severity of the syndrome and its impact on others. There were several missed opportunities. There needs to be a system of informing and training social services and emergency services and allowing access to educate children when needed. The discussion of learning from failures, the need to pinpoint who takes responsibility, and determining severity and need for early on care for families who may be on an inevitable path for failure because professionals just don't know what to do in these situations. And I think I covered everything that we talked about. I hope that I did. And thank you so much to our speakers and to Tony. That was a really, really wonderful echo today. Thank you.